Good morning, everyone. This is what you will run to me in a normal day when I'm off work or when I'm off my makeup. Normally. So basically, I wanted to do this video because I saw one of the nursing videos that I found on Instagram and I was so touched by that video. I want to share you guys a little bit about why I left my original job in the hospital and why I came to the OPD. So if you have known me for a long time, you should know that I am a patient also. I have major depression disorder, I have general anxiety and a little bit of OCD, I think, a little bit. I was reported when I was in university. I had self-harm problems, I had suicidal problems. I went to therapy when I was in college, and that was all the past. If you wanted to know my depression story, I have a bunch of the whole story in my YouTube channel, but that's just something you can go after something. So when I went to my first job in the hospital, I went to the ward, 病房, the normal ward. It was not ICU or ER or some special department like that. And mostly of my job, we take care of people. We give them meds, give them IV, give them wound cares, change their wounds, their lines on their body. And my personality when being a nurse, I like to talk to patients more than other people because I was a patient also myself. So when I interact with patients in the hospital, I would like to make them feel more comfortable or more easy when they are sick or when they come to the hospital and get therapy. Was it just a little surgery, a big surgery, or just chemotherapy or anything like that? Because when you are a patient yourself, you know that the process of getting into a therapy is tough. So I like to talk with them more while I was changing their wounds, and will ask them, oh, how do you feel today? Besides from the normal questions that we ask to the patients, how do you feel, taking their body temperatures or taking their blood pressures, or just I don't want to transform into a nursing machine, basically. So I will talk to the patients. But there's one thing about me that I sometimes get hyper when I was working. I might talk a little bit too much, or I give my optimistic side, my positive side to the patients. So after I get off work and I go back home, I take a shower and I lie on my bed and I feel nothing. I feel so empty. Because the ward I was in 2 years ago, the ward didn't have a good environment, I would say. There were some bad things. There were good things, of course. My colleagues, they have good parts, but they have bad parts. And there are also bad parts that may not come from my colleagues. They might come from other shitty process things when I was at work. You have your computer is going completely shit, or the person that you're talking on the phone has some emotional damage, and during that you're getting emotional damaged too. So I was happy when I was interacting with the patients, but there are also a lot of other things that was distracting me from being a happy person. The MDD of myself, so they might come a little bit more than other people will do. The pressure threshold of me, I think it's ultimate, it's pro, it's ultra. I think because of the meds that I was taking, or the life I have been through makes me a little bit more comforting with my pressure. But sometimes the pressure that I held is overwhelming. But I don't know. My brain doesn't really function with that. So it sometimes converts to another kind of symptoms like insomnia or like weight loss or loss of appetite, I would say. It was mostly about the after work going home and getting empty part. That really kind of make me want to end my job in the ward. I was really happy interacting with the patients, but the more positive side I give to them left more negative side inside of me. Because the positive parts that I should be holding, saving for myself, I give it all to others. So I really couldn't stand the emptiness that I got off my work. So I had a little talk with my head nurse, and she said that, I could also feel the pressure that you have while you were working in the ward. So she transferred me to the OPD department. And I think the OPD department is the kind of the balance. Like, you can still have the positive side when you're talking to the patients. You give them directions to how to finish your exams, to take your 3-month meds, and you can feel the energy when the patient says thank you or they show gratefulness to you. And you don't have too much opportunity to overwork. You don't have that much chance to overwork, like the whole working time. So after I came to the OPD department, I was still showing my positive skills while saving the right amount of positivity to myself. So I think that's one thing everybody should consider when they work and they find some trouble dealing with their emotions. There are some warning signs you should look forward to when you have, especially the emotional part, the emotion parts. Like physically, you might get a badass back hurt, you might get like sore muscles or headaches, or your eyes go bad. That's not the part that I really care about when working, because that could be solved by meds, patches, or maybe you're gonna take a sleep and everything was good. But the emotional part, you can't just deal them with only medications, or you have to have some bonds to help you through the bad sides of your job. Like you need friends, you need colleagues, you need your family, your what type of job you're doing, and how you deal with the bad things at work, like how you let it proceed into another kind of energy. I think maybe you can go exercise. Some people do that, but mostly I just talk with my colleagues, my friends, my family. I share the things that I've been through the day, through the week. So that's what makes me want to stay in the OPD department more than the ward. I'm not a big person when it comes to like dealing with death, because my grandpa and my grandma died due to cancer, and some of my friends at the age of my dad also passed away because of other sicknesses. Like some people, they stay in the ward and they say, I can't stay there, cry too many days after seeing my patient die. But that's not my thing. Like there was one patient, I think she stayed at the ward the first week I got there, and she passed away like a month before I went I went to OPD. It was sorrowful, it hurted, but that was it. Like, people go. I get it. They go because of nature, their age, their like the woman that she passed away because of cancer. And all I wanted to do for those patients is just to live their lives in the last stage a little bit more comfortable. So death isn't really a big thing to me, especially when I was the person that almost went through the process of death. So this is just a little bit of something that I thought about these days. Some of my friends came and talked to me and like, how do you deal with your nursing job? Like, do you cry a lot? How do you deal with the negative things during your job? Especially we work in a hospital, we deal with people that passes away, that get sick, people that get diagnosed with cancer, like literally every single day. I was at the GSOPD, and there was like 4 or 5 girls that was diagnosed with breast cancer last week, and like they cried a lot in my OPD room. But that was that. Some patients might think that, oh, you're so young, you look so happy, you don't have a very tough job, you have a wholesome family. How can you understand the things that I'm going through? Girl, I have way more feelings than you have about your disease right now. You don't know what I have been through. You don't know what the meds I have been through. You don't know what it feels like to have MDD and anxiety in your life. That is something I'm still learning how to cope with now. The thought of helping people, I can still process it while I'm at the OPD, while I save the positive parts to myself. So like, you have trouble in your nursing job, you can talk to me. You have MDD problems, you can come talk to me. You have anxiety problems, you can come talk to me. I will have a bunch of like a night through talk with you about these kind of disease and how you deal with like your families is going through a cancer therapy, might be the termination of his life. So that's something I want to share you guys about today. So be happy, be safe while the typhoon is coming out, and just enjoy your job. Find a good job that makes your life happy. That's it. Thank you. Bye-bye.